Pacific Peoples. This section begins with 3 panelled comments from Hui participants and survey respondents. Pacifica DPO should be a member of the DPO coalition. Hui participant. Gap much bigger than realized. Hui participant. Disparity between Māori Pasifika, which is further heightened when disability factored in. Many disabled Māori Pasifika are left behind because it is difficult to access and use complaint mechanisms. People need to know their rights and not face further stigma, extra hurdles, to realize these. Survey respondent. As one of the non-Indigenous minority populations in New Zealand, the IMM is of the view that Pacific disabled peoples share some parallel experiences with tangata whaikaha in that their day-to-day realities reside within the broader cultural context and social outcomes for Pacific communities. Like Māori, Pacific peoples also have a higher rate of disability after adjusting for differences in ethnic population age profiles. Endnote 37. Visibility and representation of Pacific disabled peoples within Pacific populations, as well as the broader population of disabled people, is generally low. Pacific disabled peoples have formed a pan-impairment network, but this is not part of the DPO coalition. Their voices are therefore not formally represented in government engagement. Poor outcomes for disabled Pacific peoples are evident across most social indicators, including healthcare access and treatment, employment and housing. Endnote 38. These poor outcomes are often compounded when intersected with other characteristics, particularly for Pacific women, who have lower rates of labour force participation and pay. Endnote 39. A significant factor affecting visibility is the lack of regularly collected and disaggregated data articulating the experiences of Pacific disabled peoples. The consequences are compounded for Pacific communities whose voices and worldviews are already underrepresented. Cultural differences, language barriers, and low cultural competence within disability services have significant effects on engagement between Pacific communities, disability services, and Pacific disabled peoples. Systems are complex and hard to navigate, and they potentially discourage Pacific disabled peoples and their families from seeking or receiving entitlements and assistance. During the consultation Hui informing this report, Pacific disabled peoples indicated that formality of language for many government processes, for example the census, impeded Pacific peoples' participation in many areas of public life. There are few Pacific community-owned or operated service providers for Pacific disabled peoples. This produces a lack of culturally grounded services for Pacific disabled peoples, and Pacific peoples have relatively low levels of contact with services overall, although this is increasing. Endnote 40. Some progress is being made to improve the lives of Pacific disabled peoples, the most significant being the newly refreshed Whakatūturu 2016 to 2021 National Pasifika Disability Plan. Endnote 41. The Whakatūturu plan has 3 major focuses: involving and encouraging better engagement with disabled people within Pacific communities, enabling people to access the right support, and building Pacific cultural competencies and partnerships with service providers to better meet needs. The implementation of the plan is supported by LEVA, a Pacific organization fostering health and well-being for Pacific communities, and the Whakatūturu Leadership Group of Pacific peoples with lived experience of disability. The groups act in a governance role, amplifying Pacific disabled people's voices and providing advice to the Ministry of Health. Recommendations. The IMM recommends that the government 4. In addressing poorer socio-economic outcomes for Pacific peoples, specifically identify and address the disproportionate impacts of these inequities on Pacific disabled peoples. 5. Continue to support the implementation of Whakatūturu 2016 to 2021 National Pasifika Disability Plan and the role of the Whakatūturu Leadership Group. 6. support and resource the further development of an autonomous Pacific disabled peoples-led organisation through which their voice can formally be included in all disability-related policy and legislative development, and in the co-design of an extended range and choice of support options.